So can you get the benefits of exercise without even stepping foot in the gym? Can you actually use an exercise mimetic to get this to happen in your body? Hey guys, Dr. Eric, the fitness physician. So I'm going to break down some new compounds. Everybody's been talking about SLUPP or SLUPP 332 is what it's called. And I'm going to give a quick summary, and then I'm going to get, if you want to, stay tuned to the end to get some of the nitty gritty details on it. But a lot of people have been asking me about this, so I wanted to give my take on it. So people are always like, I say, hey, look, if you ever wanted to get the benefits of exercise, without actually doing it, well, they have kind of discovered compounds in the past, which have been discussed. There's many been out there, been called exercise mimetics that can kind of quote unquote trick your body into thinking it's like done some more exercise and get the benefits without actually doing anything. So again, I'm always looking for different things to optimize health and performance optimization. And again, a lot of people are asking me about different products and new compounds. So I thought I'd talk about SLUPP. What do you call it? SLUPP or SLUPP 332. It's a compound. It's being talked about quite a bit, and it's been around for actually longer than people think. But I've kind of just been staying on the side, just kind of watching it, but definitely diving into the research, starting to utilize with some clients. So what is it? So basically it's a synthetic, what they call an estrogen receptor related orphan receptor, or what they call an ERR. It's an ERR agonist that functions like similar to what I said as an exercise mimetic. So basically it's a compound that can activate some of the same beneficial pathways that exercise triggers in your body without actually you exercise. Now you still have to exercise to get the full benefit, just like testosterone and peptides. So it's not like you can sit on the couch and eat bonbons and get jacked, right? It's not going to happen, right? Now, this is developed at St. Louis University School of Medicine, which is where the name came from, SLU, right? So this compound targets the ERR alpha, the estrogen-related receptor alpha, with very much a lot of precision. So basically, no, it doesn't activate estrogen like the hormone. It's very different from that, and I'll talk about that later. So basically, it kind of activates what we call an exercise aerobic mode an exercise mode at the cellular level, mimicking the benefits of endurance exercise with increased energy expenditure, increased fatty acid oxidation, improved mitochondrial respiration, or more beneficial mitochondrial function. And you know how important the mitochondria are for overall health, longevity, and performance. So it's kind of like flipping that metabolic switch, put you in exercise mode, even when you're at rest. So there's a lot to it. I'm not going to go through every little detail. I'm going to kind of give you the nitty gritty on. Then, like I said, later I'll get some more details. But basically, estrogen-related receptor alpha isn't related to, again, to the estrogen hormone. It functions as a master regulator of cellular energy metabolism, essentially controlling how efficiently your cells produce and use energy. So when it does binds the CRR receptor, it stabilizes the conformation of this receptor, making it more effective. It enhances interaction with a compound called PGC1 alpha, or peroxisome proliferator activated receptor gamma coactivator 1 alpha. That's a mouthful. It's the master regulator of mitochondrial biogenesis, which means it can help enhance the production of healthy mitochondria, which is going to provide energy, melatonin production, cellular water signaling pathways, antioxidant protection, so many other functions in the body. ERR alpha can also activate genetic programs that can increase mitochondrial function and energy production and trigger metabolic pathways that are targeted during intense work. Some of the same pathways that you get from exercise, right? These PGC1 alpha, AMP, ATP production, NAD production, so much more. So the mitochondria, most people think of them as energy factors in the cell. And when you exercise regularly, you create more mitochondria, which is mitochondrial biogenesis, and you make them more effective and make your metabolic switches, your metabolic flexibility more effective. So SLUPP appears to trigger many of the same adaptations without exercise. So when you do them together, even better, right? So again, it enhances mitochondrial biogenesis, fatty acid oxidation, your body's ability to burn fat for fuel, oxidative phosphorylation, which is the process that creates energy in your cell to do everything you need to do, and metabolic flexibility, which means you can switch between fuel sources between burning fat, burning carbohydrates, which is very important. A lot of people are metabolically inflexible nowadays, leading to insulin resistance and diabetes and metabolic dysfunction, which is what I'm trying to prevent with a lot of my clients. Been a lot of studies on this, mostly animal studies, but they're backed by a lot of data showing, especially with mice, showing 45% increases in running distance, 70% increase in endurance capacity, increased skeletal muscle oxidative fibers, and enhanced exercise tolerance. So, again, in mouse models, it's shown that it can reverse models of reverse metabolic syndrome, and it's showing decrease in fat mass, improved insulin sensitivity, increased energy production, and reduction in obesity markers across multiple measures and tracking metrics. Some other things too, it showed reduced age-related kidney changes, adverse changes, decreased the loss of albumin in the kidney, which is a sign of kidney dysfunction, improved heart function, improved cholesterol profiles. And also works at the level of the cellular level and fat tissues to reduce fat cell size, the adipose size, enhance fat burning through improved cellular machinery, and prevention of age-related weight gain without dietary restriction. So as someone myself, I focus on my trademark muscle medicine approach. This is very exciting. It's very interesting. But again, there's as we all know, there's obesity, metabolic dysfunction, and metabolic inflexibility is on the rise, and a lot of my patients are coming to lose weight, improve their performance, and look better, feel better, and that's what I'm trying to do. So by activating these compounds, SLUPP could address a lot of these things: type 2 diabetes through improved insulin sensitivity, obesity and metabolic syndrome by enhanced fat burning, cardiovascular disease, age-related muscle loss, and cognitive decline. And again, if it can do this, it's be a powerful tool. It can help in extending health span and lifespan, prevent age-related diseases, maintain muscle mass, improving performance, and improving cognitive health. This would be great for, again, people who are obese, have non-alcoholic fatty liver disease, dyslipidemia, heart disease, sarcopenia, cognitive decline, kidney function, just general healthy aging support. So people that could benefit would be chronic disease patients, elderly patients, rehabilitation patients who can't exercise or need metabolic support, or high-risk populations, or for anybody just really looking to step up their performance, fat loss, and body composition. It's kind of like a do-it-all player for mitochondrial function. I prescribe and use a lot of mitochondrial peptides, and they all have their role. And I'm going to do some videos on that later about how they're all should be used and how they should be cycled, not all used at the same time. So SLUPP is kind of a does it all kind of player, especially important for insulin sensitivity, body composition, fat loss, muscle performance, and cardiovascular health, and more. Again, a lot of the studies have been out there on animals, but more and more are starting to come out with human studies. A lot of people have been using them on their clients as well. So I think we're getting more and more data, just like all the other peptides. So again, as with everything, make sure that you're working with a qualified healthcare provider who knows what they're doing and understands these biochemical pathways and can help guide you on how to use these, how to cycle these, and more. So again, this is just an interesting approach, another thing that could be changing things in terms of preventive medicine, metabolic health optimization. Again, rather than exercise mimetics across the board, very useful. But again, it doesn't replace lifestyle, but can be very helpful to enhance precision medicine, enhance treatment outcomes, and reduce healthcare costs. So again, it can amplify the benefits of exercise, provides them based on metabolic supports, and more. So again, with everything my patients, I want to have a detailed metabolic profiling, personalized protocol developments, monitoring and adjustment of treatment responses, so any side effects, and the integration with nutrition, training, lifestyle, and circadian rhythms, and more. They all have to work together. And it's vital, again, like you said, you work with someone who knows what they're doing so they can integrate all these things. So it's a fascinating glimpse into the future of metabolic medicine. Again, you be careful. You have to weed through the hype and what's real, what's work. Again, exercise truly is medicine at the cellular level. Metabolic health can be optimized with targeted interventions, and tools like this could be helpful. So again, make sure you get your lifestyle dialed in, work out. If you're interested in learning more, join the Primex tribe. Check me out, reach me on my website or social media, drericprimex.com, taking telemedicine consults all across the country, and I can utilize such compounds like this to integrate it with everything else that you're doing and get the results that you want, get you feeling, looking your best. So remember to stay prime. Remember to live to give, do something nice for someone, pass it forward. Reach out, DM me below, let me know your thoughts. And if you have any questions, hit me up below, and we'll talk to you soon.